A very good evening to all of you at this very renowned, very popular forum of this association. Before I share my experiences related to this topic allotted to me today, express my sincere thanks to the organizers, especially Dr. Pawan Sharma ji, Dr. Vishnu ji, Dr. Vineet, and Dr. Madan ji. I am equally thankful to my other two lady speakers of the day, Dr. Anita and Dr. Anjali from Malaysia. We all are working in the field of palliative care with our resources. And I think for Ayurvedic or Ayush practitioners, this is new to know about the palliative care and what it is. Before going to in details, I pay my regards to this great saint of the era. Whoever thought that integration of ancient wisdom and modern science application is the need of the health for our nation, rather you can say the need of the universe. So I pay my regards to this great saint Bharat Ratna Mahamana Pandit Madan Mohan Malviya ji. Friends, I dedicate this lecture to my teachers, the supporting staffs, and my patients. Because without them, I ever thought that I can do anything regarding the palliative care. It was a dream. But they all supported me to develop my theme and to work on the principles of Ayurveda in the field of palliative care. No doubt, palliative care branch in the modern medical science is very late, and the journey started in 1994 when I met to Robert Tricos, who was the founder president of Palliative Care of Association of US. Then we discussed that what are the scope and applications of Ayurvedic principles and Ayurvedic doctors, how they can contribute in the field of palliative care, especially when there is no ultimate remedy for the cure. Because most of us not well aware about the palliative care, so according to WHO, they have coined a disease where the treatment is no longer responding because of the nature of the disease and condition of the patient. Sometimes while the patients are being attended by the doctors, there is a relief, and that relief is symptomatic, and that is support system, you can say rather. So what we do there, we care in toto to the patient and try to improve the quality of life of a patient, meaning that treatment is not completely fruitful to cure the disease, but we can care, and that's why care beyond the cure is the definition of the palliative care. And it is not only limited up to the patient, care of the family members even after the death of the patient. First of all, the Ralph Mount, he coined this terminology. He observed that many of the diseases are not being cured, but there are certain symptomatic responses of the treatment module, and patient can get relief up to some extent. So quality of life of a terminally ill patient can be improved, and the very same thing has been mentioned in the text of Ayurveda by Charak Samhita. You can find the reference. Before 4,000 years, they have a concept while describing the division of the making a prognosis of a patient that this patient can be cured easily, sukh sadhya, and other one is the asadhya. Then while defining the asadhya, incurable, they have categorized under the yapya and pratyakheya. Yapya means the disease which can be categorized under the palliative care. So what are the basic aims of modern medicine people? What they are doing there? They are just to make the patient to stop the downward spiral of the life of the patient. When he is thinking with the many more complications, they have to stop the downward spiral of the quality life and to make the patient comfortable at any cost and to make a pain free, because there are so many, this is not just a cut and a stitch pain, but there are so many factors of pain provoking, and to make the patient symptom free. Disease is one, and there are multiple system organ failure that causing the symptomatic disorders. And if you can cure and make a free from symptomatic disorders, that is one aspect of the palliative care. And to improve or to provide the better relief of to the patient. And ultimately, many a times, a terminal patient is dependent on any family members. So the progress of the family or the progress of the country is being reduced. And while making a patient independent and self-esteemed is another aspect of the motives of the palliative care. Sometimes while making a diagnosis and making a treatment module, we think that this is because of the cancer-like disease or the incurable disease. But my dear friends, every symptom is not always due to the disease itself. Many symptoms are due to the multiple factors we have to consider. That's why in my previous lecture I have mentioned that we have to open eye for and observing the patient very minutely. We have to examine the patient's symptomatic disorders, and that too on the basic diagnostic tools as mentioned in the text of Ayurveda, Chaturveda Pramana, Triveda Pramana, and Dashveda Pramana. So on those very basis, we have to examine the patient and then assess the what are the symptomatic disorders existing with the patient apart from the disease itself. While making a treatment module, don't limit the treatment simply to use the drugs. Drugs alone can't do anything because of the multifactorial aspect of the disease and multifactorial aspect of the treatment module. So we have to think over that. And sometimes the prophylactic treatment of the presenting symptoms is very much fruitful and helpful to the patients. So symptomatic disorders, prophylactic treatment and multiple system approach and considering the multifactorial aspect of the disease is foremost while making a diagnosis and making a treatment module. Then what is important to them? Don't limit with the single system medicine. Means each and every system of medical science is not completely, that cannot be said that this system can cure all the diseases or all the sufferings. So we have to think about the others and never say that nothing can be done. Whatsoever I have done to improve the quality life, to cure the disease, that's sufficient and nothing can be done. No, never say like that one. This is the very ethics of the palliative care and application of multiple system approach. There may be medical or non-medical, counseling, music, yoga, games, indoor games, sports, even aroma can play a better role to cure many psychosomatic disorders. So that as principles of Ayurveda, we find that there is a mind and body relation. And if a psychological disorder is there, definitely there is a somatic disorder. And when there is a somatic disorder can cause the psychological problems. So considering all those, try to use non-pharmacological preparation. Up to some extent they are more effective. So what does palliative care means? Addition of the lives in days and not the addition of days in lives. According to principles or definitions of Ayurveda is Sarira Indriya Sattva Atma Sanyogo Dhari Jivitam. Means a life is there when all these four factors are in equilibrium. Just like Samadosha, Samagnisha, Samadhatu, Malakriya. Then Prasannatmendriyamana means psychological factor and the somatic factors. They are uh, reciprocal, they are entangled with each other. So we have to consider all those factors, not only the systemic disorders or the disease itself, but the other psychological factors must be Indriya and Atma. They must be. We say that these are the Karmendriya and the Jnanendriya, but what are the factors? What are the constituents to make them? Is something different, and those are not visible by this naked eye. And that time we have to consider, and that's why I used to say a physician must have I4. Now the question arises, was the palliative care in ancient period? Was any disease which was incurable, or the disease falling under the heading of the palliative care? Was any complete treatment during ancient period? Ancient period means the history when we came to know. Prior to that, was it there? And the problems in today practice, what we face, what are the problems with the patient, and what are the problems with the treatment team, how they are going to handle those problems. And now a very big question is, can we contribute? Yes, the disease was existing long back, there was no complete treatment, but relief was there. We are definitely day to day feeling problems while handling the different types of the patient, especially cancer terminally ill patients, HIV, AIDS, and the hepatitis like patients. And then there is a large scope to contribute for the ICE practitioners in this field. And that's why I have come to say that each and every discipline of IUS must join this and try to their place how they can contribute to help the poor sufferings. Now, what are the problems with those when they are their life becomes taboo? They feel there are some physical problems, disease itself is creating a lot of problems, systemic and other problems. Definitely, there is some emotional factors to the patients, even with the patient and with the family members. And then psychosocial problems. A patient suffering from the terminally ill disease, he is in a corner of house. Each and every member, they have gone out of the house for bread and butter, and he is lonely there. His social uh, relations are limited, and then definitely there is a psychological problems. All these factors, they strike the mind of the patient, and then the patient start thinking about the spirituality of the religion. Then he start thinking that my neighbor is doing a lot of sins, but he is so happy, but I am giving a lot of love and affection and services to the poor sufferings. Apart from that, I'm suffering. So he loses his spirituality to the religion. And all those factors, physical, psychophysiological, sociological, emotional, spiritual, they all try to pinch the patient, and sufferings they precipitate, and the patient uh, start feeling the depression, anxiety, and apprehension. But when the patient comes to us, we look only one thing, that is the what is the biopsy report, what is the laboratory report, and according to that we are going to treat the patient. But that's not enough. We have to think all these four factors existing with the patient apart from the disease which is underlying. Then definitely the patient starts psychophysical depressions, because on one hand the chronicity of the disease is increasing gradually because of there is no response of the treatment, and no doubt the ill effects of the treatment are standing there. So on one hand, we are going to treat the disease, causative factor of the disease. Other hand, the treatment modules, they are giving problems to the patients. Say for that in a cancer patient, while we are treating a patient with the First one is the surgical, then chemo, then radiation, and now coming to the immunomodulations. So all these are having some sort of ill effects, and patient, on one hand we are treating the disease, but it's not being cured completely. Still, in interest that treatment module is giving this ill effects of such treatments, then definitely there is a psychophysical and social unrest, economical unrest, and overall these three give rise to the multi-system organ effect. So disease is one, expelling the effect over the other systems which are not related with the somatic disorders, but psychological problems, economical problems, social problems, religious problems, and ill effects of the treatment modules and chronicity of the disease. Over and all, patient sinks into a great depression. So we have to take into proper consideration while we are going to handle a patient of terminally ill. Then coming to the what are the diseases which can fall under the heading of palliative care. The disease itself is incurable, and patient gets some relief by the symptomatic treatment, and but it aggravates shortly and produces anxiety, uneasiness, disorders of the consciousness, and gradually there is a multiple system organ failure and ultimately death, leaving behind the pain. With the pain, patient dies with the pain, patient leaves the pain in family and the society. So these are the diseases which are definitely incurable, but we can provide a pleasant life, and we can add life in the rest of the life span of the patient. That's why this is a palliative care. Many symptoms you may observe in a patient related to GI systems, genitourinary system, psychophysical system, and hepatobiliary system, and cardiorespiratory systems, endocrinal system. So all systems, they become gradually sick and sick, leaving behind. Sometimes we will not find any visible injury to the patients. Say for that, a patient came to me and said that, Doctor, last week I was feeling very well, but after that I'm unable to take my meal, two breads or three chapatis, and now it is difficult to get one. And I have no interest while to take my breakfast or the dinner and lunch. So, but there is no visible pain like an assault or like an a cut and a stitch and injury. But there is a invisible injury which causes the pain to the patient. So unrest and discomfort realized by a patient not only because of the systemic disorders but their physiological functions, and their unrest or alteration in day-to-day daily physiological activities of a particular system. They may develop newer and newer problems in a patient which is not bookish. So you have to think about those problems while making a diagnosis and treatment module. Sometimes patients comes to us with a small story which is visible or can be observed or can be analyzed by laboratory and others, by history, but a large story inside the body and mind is still inside the patient's, that is like an iceberg floating on a water. A small story we can learn, but a large story inside. We have to analyze, we have to find out that largest story or a big story of body and mind inside the patient's body. So this is very important when we observe such a small story in a patient and find that this symptom is sick because of this disorder, because of the laboratory finding they are supporting, the questionnaire is supporting, and the observations by examining the patient is this much only, but that is not enough. Then we have to observe patient very minutely to get uh, concrete information from that sickness. Many patients used to come say that I'm your regular customer, my dear pain. At least discount me in my pains. This is the version of a patient who is asking to requesting to the Lord pain, and that pain is the King of the kingdoms. My dear friends, while we are going to specify the pain of a patient, which may be physical, psychological, social, spiritual, then we have to think that this very pain has many threshold factors. The very same intensity of the pain is different in different individuals, and that is according to principles of Ayurveda, means they and manas prakriti of the patient be considered while thinking about the painkillers. There are many more drugs. There are many limitations to use those drugs. Sometimes we can't advise the patient to take it orally, injectable, and liniment. And there are many alternatives, no doubt. So we have to think about the alternatives of the painkillers according to the patient physical illness. And no doubt this is a very big question why majority of the drugs, synthetic drugs used by modern people, they are not devoid of any untoward effects. They are full of untoward. While we are going to cure the patient's pain, somatic pain, and meantime patient is not taking proper meal, and we are advising this NSAIDs and other things, definitely the patient will suffer from the GI upset and hyperacidity. Same thing happens with the potent analgesics by which the other analgesics are being tested, that is the morphine and its derivatives are used in palliative care for the pain management. And that time we find that while using this drug, gradually there is a drug abuse, constipation, insomnia, giddiness, dizziness, and so on. So, on one hand, we are going to treat a patient's pain, but we forget about the fundamental principles of Deha and Manas Prakriti, analyzing with the Tridosas component of Ayurveda, that how the Ayurveda is. They are supporting that if it is Vatas, the diseases of Vatajasthana, and disease nature is Vatas, and Prakriti of the patient is Kaphas, then the treatment module is different. So we have to consider all those in principles in respect of the Ayurvedic fundamental principles of the disease, and the Sattvavajaya Kriyakal is very much essential to analyze or to applicate here. In a terminally ill patient, what happens? Gradually, there is a decrease in the immune power. Vyadhi Kshamatva is decreased gradually, and when there is a metabolic function of a patient is decreased. That's why while defining the definition of Samadosa Samagnisha, means that what are the building materials, either this may be Trigos or Panch Mahabhautik, they are the building materials of the unit of the body, that is the cell. And there is a metabolism inside the cell, and when it is distorted, deteriorated, the metabolic function will gradually decrease. Then how we can presume that this very person will be healthy, and according to definition of the swasthya or health of a patient. Then when immunity is decreased, definitely the power to fight against the disease is decreased. Metabolic function, the force or the energy inside the body is decreased. Definitely there is a decrease in the quality of life. Because while there is no energy, then it is very difficult to think about a physical movement of a patient or the freshness in a person suffering with a disease. So quality life is to be maintained by enhancing the immunity and improving the metabolic functions. And when all these three are there, definitely there is symptomatic disorders. If energy is not there, metabolic function is reduced, appetite is reduced, MNT is reduced, definitely the patient will not be able to move, and there are chances of bed sores. So these are certain examples by which we can understand very well what the patient's problem is there. So we have to think how one started or one started to affect the other system of the essential factors for the life and the health. So the challenge arises in front of us that there is no response of the treatment, unrest is there, quality life is poor, so patients start losing faith in God and religion. This is the very big problem, and the IUS has mentioned that this should be considered. And many times we forget about the principles. No doubt we are working in the very same direction with full interest, but while making a diagnosis and treatment module, then we forget about all those factors, because whatsoever treatment we are going to provide a patient is not responding to the patient at all because of the poor condition of the patient, poor metabolism of the patient, and the chronicity of the disease. There is no specific treatment to kill that causative factor or the vector. So definitely there is no response of the treatment. So this should be considered. These are the problems. So what should be our approach to cure a patient? That is not possible. Then restore the function. Sometimes we can restore the function by systemic support, and we prolong the life. Mind it here that the prolonging of life means with the quality life, not the diseased life. And then patient requires comfort always. Even though you have cured the patient, try to cure the patient, restore the functions, and improve the quality life, but there should be always be a comfort to the patient, and that is mandatory. So, my dear friend, these were the modern concepts of this palliative care and the palliative disorders and the palliative sign and symptoms what we find according to WHO. Now, what Ayurveda say? When Ayurveda says that Ayush system of medicine says that when there is a incomplete cure, but we can cure a patient according to fundamental principles and approach of the treatment, we can provide this one. Prior to that, we have to say that what Ayurveda is. We always think that we always used to say that Ayurveda is a text originated from the Atharvaveda, the holy book of Hindu system. But Ayurveda, when you go through the text of Ayurveda, a lot of texts are there. You will find that there is, it deals with the art of living. Art means the stage where a character plays, and according to need he performs better and better, which can be accepted by the audience. That is the artist, and that is art. So in any bad circumstances, good circumstances, weather alterations, climate alterations, if you have to be live with the quality life, that is the art of life. This is mentioned in the text of Ayurveda, and rich mind of there. Then it is not only the text of health and disease, it is philosophy of life. As and when we learn Ayurveda, we find that life itself has its own philosophy, and Ayurveda deals with that one. Ayurveda is a complete sociology. When we think about the uh, development of any nation, and that development depends on the health of a citizen, and that's why we can say that we are the social animals, and when any creature of the god in a society is sick, that affects that society, and that Ayurveda says that in complete society, in a particular criteria, in a particular environment, this disease may fall. For that, you have to follow this regime according to seasonal variations. Ayurveda is a culture. Psychophysical happiness is the culture. Culture is not just a symbol to celebrate Holi, the festivals, Holi, Diwali, Dussehra, New Year. No, this gives a lesson, that is psychophysical. We used to meet with each other, and we celebrate, and then we feel that we are happy. So psychophysical happiness as the culture is mentioned in the text of Ayurveda. Then Ayurveda is a religion, And that religion is Vasudhaiva Kutumbakam. We think about the health and happiness of the whole universe creation. And that's why Arvind in the last says that someone is there who is looking after you, who is insisting to you to perform according to the principles, to perform according to the need, just for the development of a nation, for the development of newer generation. This is Ayurveda. And nowhere you will find that this type of definition or this type of themes which are completely incorporated, or you can say that completely mentioned in the text of Ayurveda in different references, you will find that this is and that to be applied in our society, patient sufferings. And when we follow this one, definitely we will live with the Ayurveda. This is a reference. There is a font problem, but where it is mentioned, when I came to Robert to know about Robert Tricos, he said that this is palliative care and very new branch in the medical armamentarium. Then I asked him, sir, this is mentioned in our text of Ayurveda, and that what are the definitions you are trying to convince me? It is very much mentioned 4,000 years back. Then he asked me, yes, if it is, then show me. Then the next day I went to him and showed the reference. Then he said that you have to work on this very, and definitely the society will be benefited, because there are a lot of problems making the diagnosis, making the treatment modules, and to make an overall care of a patient. That is Ayurveda is better, and that was his uh, words. So this I have taken from the text of Ayurveda, that is Charak Samhita. Shesh dosatvad ayuso yapyam asadhyam path sevaya labdhalpa sukham alpena hetuna supravartakam. Means if lifespan is there, and when we use some symptomatic management, problem relieving management, but because of any obnoxious or untoward situations which are not feasible to the patient, the disease the disease may precipitate in more dangerous conditions. So this is when that disease develops with the chronicity and it spreads sthana sansraya, then pressure sthana sansraya. When it goes into uttarotter successive dhatus or building materials and deep-seated disease, asthimajja. That's why the bone tumor or bone carcinoma or osteosarcoma of a patient is incurable. According to principles of Ayurveda, if the disease goes deeper, 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 then it becomes difficult. And when it attacks or it gets situated over a marmasti sandhi, means where there is a multiple system, vital systems are there, and the disease get accumulated there, definitely the disease is incurable, and sometimes asymptomatic relief can be provided to the patient with the alternative therapies. That's why it is under the category of incurable disease, but that is palliative. What happens when a patient is suffering with the palliative disorders? Uh, According to principles of Ayurveda, the three-dimensional treatment, first of all, is to remove the causative factor, which is not possible because disease already precipitated there, inoculated there. But the improvement in the metabolic energy, that is Agni-Chikitsa, because we know that Agni means Samanvayu, Pachak Pitta, Avlambak Kapha, that is in, in the area of the gastric zone, and when there is a sick liver, it will cause, means the ill effect of the treatment, whatsoever ill effect of the treatment is there, poor health is there, stress is there, and socio-economical unrest is there. So disease has been progressed, and over it affects the Agni Asthan, and then the metabolism becomes poor and poor. Drug detoxification is not properly there. Immunity definitely will decrease, and the quality of life will decrease. So second aspect is to improve the metabolism, and that way the samadosa next samagnischa. Samadhatu is later on, means the cell which is the unit of the body, and Agni means the metabolic energy or metabolic function of that cell, which is responsible to get the development of the seven dhatus and gradually in successive manner. So when the Agni means their metabolism itself is distorted, decreased, altered, definitely the neither there will be detoxification, neither there will be proper metabolism, and there will be decreased immunity. Definitely, you can think very well what will be the quality of life of a patient. So, application of the principles of Ayurveda is very much unique here, and that can be utilized. Then, coming to the concept of the treatment, or you can say the care of a patient, there are tri-dimensional module of treatment of Ayurveda. First one is the Daivabhapashraya, second one is the Yuktibhaprashraya, and third one is the Sattvavajaya. These three-dimensional treatment module is very much useful while making a treatment. But prior to that, one thing I would like to send my message there. It is not always required to be a doctor or a member of the medical team. A person who is terminally, this patient was executive engineer, and because of this terminal disorders, you can say that what is the psychophysical unrest, and the picture of a patient is self-reflecting the problems living with the patient, and what the impact of the patient in the family. A millionaire has come on this floor. You can see that what are the socio-economical, financial, spiritual, and so many factors which are leaving impact over the family other than the patient his or herself. So these are the problems with the patient of a terminally ill. How? When we started this palliative care work, ideally from to 1994, then after 2000, I came into contact with the Department of Radiation Medicine and Radiotherapy, and I must thank to them that they have provided me an opportunity to select the patients and utilize our principles and drugs according to Ayurveda. And this was found that this minimizes the untoward effects of the treatment modules, or the well-known side effect of the chemo, radio, immuno, and surgical interventions. Sometimes it minimizes, or you can say that many times I have found that there is a complete cure of the symptomatic disorders, and excellent result was found in the correction of the metabolic dysfunction when the SGOT-PT was more than 3-4 thousands. After 1 month treatment, it came to the normal values. And when a patient feels better, definitely there is a psychophysical imbalance which was not there. A patient was in depression, anxiety, apprehension, dryness mouth, and so on. It was improved there. And very well known to all of us that even modern people, and thanks to Corona, who has showed the mirror to the society that Ayurveda has many more drugs, and that can improve the immune system. And definitely, when I used to treat my patients, I found that there is a definitely improvement in the immune system of the patient, and once there is immune system is improved, definitely a lot more diseases can be cured and improve and restore the quality life. When all these factors what are mentioned in above are responsible for the quality life, and that can be achieved even though it is now. I used to say that I can't cure the cancer itself, but I can help to improve the quality life. I can help to minimize the untoward effects of the treatment modules. I can improve The metabolic dysfunctions or psychophysical imbalance can be corrected with the help of the fundamental principles of Ayurveda and the drugs mentioned which are suitable to you. And that is the motive of this. But prior to that, one thing I used to come to my patient that what they used to demand me, they need the proper and adequate analgesia. It may be psychological, it may be somatic. They want to be mixed with the society. They want a friendly behavior. Many a times my patients they ask me, sir, can you give me your contact number? As and when I require, I can chat you. I used to provide them. Even midnights they used to call me that doctor, I'm not feeling well. Can you suggest me what can I do? Yes. When you are a friend, definitely you have to behave like that one. Then healthy family environment you have to create, you have to educate the family members that try to maintain a healthy atmosphere to the patient. And natural living is very much essential. Not if you the patient is not living naturally, definitely he thinks that he is burden on earth or the society or the family. And overall what the patient demands, that is the satisfaction. Satisfaction is foremost important factor while you are going to handle a patient of the terminally ill nature. Then how you are going to be success? First of all, you have to listen properly. It may take time. If you don't have that much, you don't and you can't get the success. But gradually, many times patient used to come with the written application like this one, sir, this I am having such problems, and this was yesterday, this is 1 week prior, and I had a lot of problems. Then I used to listen while I used to observe their facial expression while explaining their complications or the complaints. Then think that what are the severity of that complaint. Then after listening, we have to give a better explain the patients in his her own language. Then try to find that whether whatsoever you have transmitted, patient has learned or not, understood or not. Simply explaining is not matter. You have to think, you have to check that what you have explained, patient is following or not. Then after these two, you have to maintain a positive rehabilitation setting, and that must be suitable to the patient. It is not like universal to writing of pharmaceutical companies prescriptions. No, not at all. Many times you can find a large number of drugs in the periphery of the patient. You just find the area where the patient is coming from, because Anup and other climatic areas, what the cultivation of the herbal drugs may be there, and which form, which first form can he get. So all those must be taken into consideration, and then yes, this principle must be followed there. Otherwise, not. Then where you have to focus? First, nutrition. You have to provide the good energy, and this good energy after the Agni treatment, metabolic improvement. When patient starts having a good nutrition, definitely the battery is charged and patient is going to be immune. Then mobility. Patient must be moved, not a bedridden, because stagnation is not the characteristic feature of the life. Life means you have to move, you have to run. Then improve the mood of the patient, and then independence. Make a patient self-esteem. He has he could perform his daily routine. Make the patient, assist the patient, try to help the patient in that very direction. Then what should be there? The treatment module must be relevant to the patient, comprehensive. That must be excellent and multidisciplinary. It is not that the patient is upset, is not taking meal, but you can switch on your transistor and ask the patient which movie is and which song is your favorite ever. Then try to play that one and then observe what are the feelings of a patient, what are the mantra chanting is there, and how he is going to involve in that. So multidisciplinary, what the problem of the patient is not able to take any painkiller, and joint pain is there because of the long lasting bedridden. Then have a help of the physiotherapist. He will come and give some exercises and patient will feel better. Then that treatment must be consistent and continuous. Not there must not be any interruption and well coordinated home. That must be well coordinated. There is coordination between the palliative team. If you are not able to attend the patient, your any person of the other specialty or the same specialty or medical or non-medical have to attend the patient to cure the patient. Then coming to the spiritual therapy, Daivabhaprasad, the first foremost mentioned for the treatment module, when patient starts thinking that loss of faith in God, there is deviation from the religious act, means patient is towards the psychophysical depressions. Then Dharmopadesha is the only way. And that time many sorrows can be washed out, and how it is going to help, because the Vedas are not just a text of Hindus. Vedas, any holy book of any religion that is worshipped by that society. And every religion has mentioned the philosophy of life and death. And then faith, try to inculcate the interest or the faith in the God and try to motivate the patient in religious act. Can you imagine when any one of our beloved is we lost there are certain rituals, and with that rituals we care the family members even the death of the patient. It decreases the sorrows and pains led by that victim of the terminal case, and that time it improves the quality of life of the patient if he is alive, and the family if the patient is died. In all those sense, the chanting, the discussions mentioned in the Vedas, holy books of the religions, where the patient has lost the faith in God and religion, that can be shared with the patient. How it is going to help? It is drugless therapy. Definitely, there is no need of a metabolism, detoxification, and the eliminations. It provides the peace of mind, enhances mental healing, reduces stress, improves quality life, and emotional support is almost required. When there is a mantra chanting, then there is no expenditure of the drug purchasing, there is no side effect of the drug, there is no any foundation to take it orally, injectable, or in other ways. So the Vedas are drugless therapies in terminal patient, and they are harmless. Then coming to the second aspect, that is objectively planned therapy, Yuktibba Pasra Chikitsa, means you have to design the treatment module, that is use of specific medicines, potent analgesics, symptomatic disorders relieving medicines, improvement of the metabolic activities, good dietary regime, use of rasayanas, and ultimately use of good code of conduct. It is mentioned in the text. I am not going apart from that Ayurvedic text. All these things are mentioned in our text of Ayush. In my experience, what I have found that I had tried to combine the analgesics and the media drugs. On one drug is minimizing the untoward effect, and dose is reduced of the analgesic whatsoever patient we are taking, and to minimize the stress or the psychological problems or induced disorders, there is insomnia, and that time media drug is effective. So many more drugs of these two categories, Vedanas, Thapan Vedanas, Amaksul, Prashman, and Medyas can be selected. Brahmi, Ashwagandha, Sankpuspi, Amalki, Guruchi, Tulsi, and so many drugs I have observed clinically on objective and subjective parameters. Uh, Biochemical analysis was there, and I have found there excellent results in psychophysical response, and that I this metabolism comes to second hand, that is the improvement how metabolism is, and the diet can help a patient. We simply say that this balamarogyam ayusham pranasya agni, means bala. What are the bala? Bala means not the physical power, it is physical as well as the mental power. Arogya means when you are highly immune, you are in good health. Ayushya, quality of life, and prana, longevity with the proper vital function. Then only we can say, because yavat prana is there, then the life is there. If prana is not there, dasayu aitanyahu prana yesu pratishtha, means your 10 seats of the pranas are there, means they are the most vital sites from where each and every systemic functions are being controlled, governed, and they are maintained in harmony. So when there is a proper diet, there is a proper metabolism, all these four factors which are very much essential and important for a quality life is there. Then use of methya drugs. Methya drugs means the dhriti smriti is the basic characteristic features or the pharmacological properties of the methya drugs. They reinstate the positive mental makeup, they revigorate the physical performance, they revive the social activities, and sometimes they try to cure the insomnia like disorders. Herbal anxiolytics, what I have stated earlier, I have observed on EEG, EMG, bispectral indexing, catecholamines, sugar, and the cortisol level. In my study, I found that the uh, quality life of patient was improved, and the I would like to quote here the scale designed by Padma Shri Professor IRES Singh sir. He had designed the OJAS negative scale, and while observing my patient on that very scale, I found that these drugs are very much effective, and the principles what I have used in treatment of the palliative disorders, I found excellent results were found. Then the pain of any type, psychophysical, and the insomnia are psychological, can be cured with the herbal analgesic and method drugs. They are improving the quality life, quality metabolism, and the improvement in the quality function of the body, and definitely there is an increase in the immunomodulation. And I used to provide all these formulation in different ways to the different patients at different stages of cancer or terminal ill, and that too along with the conventional cancer therapy, you can say that the chemotherapy and radiation medicine. How rasayanas are important. This corona has given that rasayan treatment of Ayurveda is very much effective for the longevity, free from disease, memory enhancement. And in corona, post-COVID symptoms, it has been observed there is a insecurity, feeling of depression, feeling of irritation, and that I used on those patients the rasayana therapy found better. Youthfulness, power, excellence of luster and voice, modesty, brilliance, optimum strength and physique, and optimum strength of the sense organ. Means Atmendriya mana swasthitya bheti. So the physical, physiological, psychological, and spiritual all aspects are being maintained with the use of the rasana or promotive therapies. Other adjuvant drugs are there, nutrients, weight promoters. These are mentioned in Panchashat Mahakasaya chapter of Charak Samhita. And you will find there are a large number of drugs you can pick from them, and according to need of your patient, according to category of your patient, you can pick any of 10 and then use and formulate as and when it is required, or you can. Then lastly, the third concept is SATVAVAJAYA CHIKITSA, means the psychological therapy, and it is very much important. One of my friend, Dr. Gopal Vasist, practicing as a symbiotic physician in Texas, when I met him 10 years back, then he explained how the symbiotic approach of Ayurvedic and modern medicine is there, and the amalgamation of the uh, these two, Ayurvedic system and the modern medicine, drugs of Ayurveda and modern, can help a patient with the better safety and better results. So developing quality of mind for freedom from disease is the characteristic feature of the Sattvavajaya Chikitsa. Application of, you can use the application of yoga. My few students are PhD. They are working on the practices of yoga and their impact over the terminally ill patient in last terminal stage, you can say the third and fourth stage of the cancers. Then interesting game just to divert the patient's mind from the disease and other components patient involves, and try to make a victory of a patient while playing with a team, and then observe the pleasantness of the pleasure of that very patient, that he's knowing that he is now of no longer span of life, but he thinks that before that I won the game. So you try to develop that one. Then if he is interested, you provide the videos, video games, music, and the library, and overall the counseling is the best. So you must be a good counselor there. Try to snatch all sort of sorrows and pains from the patient, and then you are a good counselor. And over and all, love and affection is very much required to a patient of terminally ill. So symbiotic human touch is there, and that is from the Sattvavajaya treatment and the psychological therapy mentioned. My dear friends, when you are alone in your family, then observe the experience of taking meal alone. And when you are not that much rich, but you are enjoying on a dining table with your family and friends, this is the message of psychological issue. And then observe that nothing would be more tiresome than eating and drinking if they are not a pleasure as well as a necessity. That's why it is. So social mixing is friendly behavior is very much important there to take to care the terminal patients. Then application of aromatherapy, again the problem of the font. Trembakam yajamahe sugandhim pushtivardhanam. This is the version mentioned here, and how aromas are very much helpful. My dear friends, you observe when you used to go in a party, picnic, or any other place, or you when you are going to worship your Lord, and when you are going to sleep in bed, then you try to improve your some cheerfulness by using the aromas. And how aromas are helpful? They are just to inhale. They are not either you rub on your skin, they will show their effects, but they are not that much harmful to anyone. Uh, Rejuvenative, beneficial to health, elevates mood, cheerfulness, strength, improves the vital function, reduces the induced disorders, and relaxation of mind and body. Antidepressant action is there, and the analgesic properties. Sometimes it provides the rehabilitation and the non-invasive therapy. So aromas are very much effective in those subjects. Then, before going to select a drug for objectively plant therapy, you have to select those drugs which improve the asthenia and anorexia, release constipation, because that is more common in terminal patients. Then rasana therapy to build the immune system and enhance the memory and cognitive functions. Then anti-anxiety, good analgesics, anti-cancerous, freedom from the drowsiness, and antidepressant. These are certain criteria that can be taken into consideration while selecting a drug for formulation of a treatment module. So how Vednahar and analgesic and nootropics can they perform their actions? They are good in anti-stress adaptogenics, safe at any age, minimize the analgesic dose requirement. Many times I have found the patient was taking 30 mg of morphine, tedious, but at present, after 2 years, the patient has stopped completely taking morphine. Gradually, they reduce the dose of the morphine, and so the herbal analgesics are very much helpful in this. So provide sedation and tranquility, provide analgesic, provide better outcome when we use herbal analgesics and this Vedna Dravyas. So our focus area is to improve the immune system of patient, to provide certain analgesic effect if it is, then provide the antidepressant. And depression is foremost problem in a patient when he is suffering from the terminal disorders. So you have to think about what are the antidepressant pharmacological, non-pharmacological, and their feasibility according to need of the patient and condition and economy and the other situation of the patients. So sometimes there is a chance of insomnia because of the psychophysical disorders. There is anxiety. Many more drugs are mentioned in the text that can be utilized. So over and all, the correction of the metabolism is very much important here. Once you have corrected the metabolism of a cell, then definitely there is a formation of the good successive uh, tissues, or you can say the dhatus. When the tissues or dhatus are in a good and better productivity, definitely the health will be better and the patient will have to good confidence in the health. Our problems, what are the problems? Like a terminally ill patient is like a hut which is distorted by a storm, and when we have to provide the patches here and there, then definitely that will provide a shelter. But that is not ultimate treatment. We have to come together, make a collective effort what we can, and then think the vision what you can achieve. So first you have to think the problems, come together, and use the help and take the help of the other specialties, and then try to achieve this goal. So that can be achieved with the positive approach, not beyond that one. So this umbrella care, I have designed this one for my patients, that you have to take the Ayurveda, help of Ayurveda, allopathy, yoga, Siddha, Vedas, Unani, aroma, cultural, spiritual, sports, psychological, music, homeo, socio, naturo, all these. Those who are doctors are medical personnel, those who are not. But you can take their help to treat the multifactorial disorders of a patient and multi-systemic disorder of patient and multi-psycho, physico, physiological problems of the patient by providing this umbrella. Each and every spike of umbrella is a system, is a pathy, is a subject that can be taken and their help, and then you can think about the care of a patient beyond the cure. And this only is the umbrella of the Ayush. So what is the Ayurvedic approach? It strengthens the immunity, it is efficient in detoxification. It's responsive to minimize the inflammatory lesions, provides optimal metabolic functions. It balances the regulatory function of the vitals. It enhances the and regenerate the damaged tissues. It harmonizes the life forces, and naturally all over world it has been come into existence last 30 decades that there is a free radical scavenging or antioxidant properties. So all these are rich in Ayurvedic, and so we have, why don't we take the help of the Ayurvedic principles and Ayurvedic formulations? So definitely having this much vast fruitful properties, qualities, we have to utilize that one, because our purpose is more important than the need. Our purpose is to provide a good relief, excellent quality life to a patient in a terminal stage. Because in a race between lion and dog, many times deer wins, but lion runs for food and deer runs for the life. So we have to run for the life that is quality life. Maitri Karunyam Arteshu Shakya Preetarupekshane. These are the characteristic features of a physician, and that must not be forgotten by us. Nowhere it is mentioned except text of Ayurveda or the Vedas. Because unless you are not having any Samvedana, it is difficult to read the Vedana of the patient. And no pathy is complete deprived of sympathy. So if you want to create a patient, then have some Vedana and sympathy, Maitri Karunyam with the patients, then only you can. When I started this palliative care unit, this is the unique unit in my department. And when I established this palliative care unit in Department of Sangyan BHU, this is the first and ever in the history of the world that palliative care unit is running very good in the department, and that is in the faculty of Ayurveda, and that is Banaras Hindu University. That is the vision of Mahamuna to amalgamate ancient wisdom and modern sciences to cure the disease, to cure the sufferings, and to help those people, those who are in real need, and that we have established. And the blessings of the then Vice Chancellor, Professor G.C. Tripathi sir, he inaugurated that one. So drug is not enough complete. Spiritual and physical health are equally important. So we have to think about the holistic approach of Ayurveda and realize that can be achieved sometimes by the drug and sometimes the tridimensional module of the treatment, as mentioned in the text of Ayurveda. So, my dear friend, sympathy and samvedana can cure the patient even though they are in terminal stage. But if you are having samvedana, look a smile over the face of the patient and observe that patient is taking milk when it is not able to take anything or not able to swallow anything, but he is taking because, and how think there, how he is holding the hand of the nursery care taker, that he is giving the blessings to the patient, he is giving that human touch to the patient, to the doctor or the whatsoever is there. So look at how it affects the psychophysical impulses. They are improving the systemic disorders that has been developed in the terminal patients. I used to go in ashrams and where the patients are there and they are unable to come to my OPD or hospital. I used to go there and to serve them. Sometimes they are suffering from the joint disorders, unable to move, and sometimes they are poor metabolic problems. Then my single visit is sufficient to them. They the cheerfulness what I used to observe them, that is very much encouraging to me. They are my patients, CA esophagus. I haven't seen the patient. It was only on telephonic conversation. Now she is fine, having the CA esophagus. Was not able to swallow anything, but now she is quite fine. I am passing the life like a normal person. This is a squamous cell carcinoma of oral cavity, and now is very well. This MR after MRM, the wound was there, Agni-Karma and dusting of Madhuyasti and the extract of the marigold. The patient is now cured. This is a patient came to me from the Nepal having swells carcinoma of the buccal mucosa. Now you can see the result after 3 months. And this was patient of spine tumor, was unable to move, and she was a burden on family. When she came to me on a stretcher and they asked me that give some Ayurvedic tonic, I am going, and the doctor has refused. Now the patient is on her own legs. She is moving here and there, attending her husband, and the patient who was on bed, but now she is quite fine lady having a marketing. These are certain pictures of carcinomas and their problems and systemic disorders. The CA colon was there, operated, colostomy was done, but the chemoradiation effect was on the buccal mucosa and the patient is cured now. There was a fistulous opening of the CA chick. So coming together is just beginning. My dear friends, we have come together, it's just beginning, and I will try to have this uh, to make it to keep this togetherness, to make our progress, and when we start our journey, definitely we will success to up to some extent. So my dear friend, the quality life in a terminally patient, because the patient is having social relationship is one problem, emotional well-being is required, quality of environment is in the family and society, work culture, health and financial material is well-being, and belongings care is very much, and overall and the personal safety patient wants, and that can be achieved by the quality care, quality life, and that is mentioned here and there in the text of Ayurveda, that can be utilized. So one home, home carry message is a wise physician said, the best medicine for a human is care and love. Someone had asked that if it is not working, then he smiled that increase the dose. When you find that the yesterday's visit was not sufficient and the formulation was not effective, then increase the dose with the love and affection. Definitely, your patient will improve the quality life. So we are just instrument in the hands of God. God is there. Destiny is always decided. But what the better we can do, that must be our knowledge, our approach, our discussions, and our team. The palliative care work depends on these factors and multi-system approach, multiple track approach, and with the safety of the patient is very much essential. Otherwise, God is there, He is helping us, and we have to make a keen object that we have to pass goal, that we have to help the suffering, we have to cure the suffering, we have to help the nation, we have to a vision to develop our nation. With these words, I express my thanks with this pray that Sarve Bhavantu Sukhina, Sarve Santu Niramaya. My dear friends, the topic is new, but I think I was able to convey my message up to some extent to help the real needy persons with the principles of Ayush, with the principles of Ayurveda. Thank you, organizers, especially Dr. Pawan Sharma ji, and many congratulations to having that much awards of the this organizing this international conferences. Thank you all. Thank you.